As you can see, we have current case count up to date, but the new cases recorded from the last update, 697. But it brings the situational report as us having 8 critical cases, 6 of them on a ventilator or ventilators, and the severity being the category of some 22. As we move on, look at these cases explicitly. We also know that the active case count 5,093, and the recoveries have been pegged at some 14,870. In the meantime, we've only recorded 122, only because if you compare to other countries in the sub-region elsewhere in the world, these numbers are still low. But in total, we have up-to-date case count 20,085 cases of coronavirus. And Greater Accra is always leading the charge, and the Western North with 154, and then other regions subsequently among the 16 regions of our republic still recording some of the lower numbers. Upper West has 55. Before then you would have 112 for OT region, and Savannah, Bono, Ahafo, and Northeast region, which has the least number of cases, 8. But let's get on to the lines and speak to some of the experts as they give us a breakdown of the analysis of the current case count and what it means to the population in general. We're speaking to the population issues because there have been concerns about our inability to be able to maintain the needed protocols across board. And that is why population experts and those also who look into the dynamics of public health in relation to growth of the population and the dynamic itself have become very important. Let's speak to Dr. Eugene Datte, who is a population and health expert with the University of Cape Coast, one of the foremost universities we have in Ghana that has a whole department that looks at some of these dynamics. And good morning to you, Dr. Datte. If you look at our case count currently, what will be your own observations within the period, especially over the last 4, 5, and 6 weeks?
Thanks very much. I think there's been some increases over the last 2 weeks, and the question is, where are these increases coming from? I think it will be very informative if we get data that will show exactly who these new cases are and where they are from. For me, it will be judgmental to say that the cases are out because of the registration.
Well, we seem to be having some difficulties with the line to Dr. Eugene Datte, who is a population and health expert with the University of Cape Coast. As we look at the broader dynamics, we also do know that we have to get into some of the intricacies of why the populations per meter square and how that could have some implications on whether we adhere to the protocols and its effects on public health. And Dr. Eugene Datte will help us do that. But again, we'll have to go over our case count, and it's where we again have to apprise you of what the numbers are. We're in the region of having crossed up-to-date case counts of some 20,000, but the active ones are 5,093. We have 14,870 recoveries and discharges so far, with fatalities pegged at 122. As far as the new cases are, as have been reported over the last updates, we have 697. Well, it's where we have to go back to the phone line. Dr. Eugene Datte is on the line, and you were saying, please continue from where we left off.
Well, like I was saying, yes, there have been some increases, but the question we need to ask ourselves is that we need to understand who these new cases are. Where are they coming from? Because for me, it will be a bit judgmental for us to conclude that the new cases are the result of the voter registration exercise. Before the exercise, the cases were going up. Now, with these new cases, I think we need better particulars. We need data that would support the assertion that the cases are rising because of the voter registration exercise. I've gone out myself. I did my registration yesterday. Where I did my registration, the protocols were observed. So the question is, the places where the protocols have not been observed or are not being observed, what is the reason? And I think we need to put in place the systems to ensure that the protocols are observed. The process has started. I'm not sure the process is going to be curtailed. What we need to do as a people is to take the responsibility for our lives and ensure that once, as we step out there to engage in this process, we do what is expected of us. And I believe that once we do that, all should be fine with us.
There's an intrinsic link to population spacing and then the infection and spread. What can you say about that, sir?
Well, the general knowledge is that once there's crowding, once there's a lot of people, there's a likelihood of an increase in the spread. But we should also appreciate the fact that people are out there doing this exercise, and on the average, when I went out there, the average time was about 30 minutes maximum. All the people I met in there had masked on. The EC officials insisted on the protocols being observed. When there are large crowds, there will be a few people who would want to break the protocols. But that's where there are the presence of security officials at these centers. The citizenry should work closely with the EC officers and the police to ensure that there's law and order. And I believe that with the protocols that the EC has put in place, if we observe the protocols, if we stay responsible, the process will go on smoothly without any real issues. Like I said earlier, the numbers definitely are going to go out because there are other places that people go to. The most important thing is that there are a set of protocols, there are a set of guidelines, and each and every one of us must ensure that we go by these protocols and set of guidelines.
There's a publication that was put together by the Public Reference Bureau of the United States of America, and it drew great links with the population density of communities and the likely spread of the virus quickly around the world. We have been a bit late in getting the surge in the virus. Would you say that perhaps now that we are having the virus, our population and the dynamics of spacing has got a certain link to it?
Well, definitely. It's a main fact that the virus spreads faster in the places where the density is high. And if you go around our country, most of the places have high density. Look, Accra has a very high density. There are areas in Accra where social distance is just not possible because of the way people live and the way people interact. But that is where we need to emphasize the need to observe these protocols. See, what we're asking people to do require time for them to do. People would have to adapt to new behavior. People have to adjust to the new normal. And it is not an event, it's a process. So we need to ensure that we work on people's mindset and move them from a state of mind, a state of behavior where they could do things anyhow to a point where they need to be restricted in the way they do things. It's not easy to change people's behavior. It is a very difficult exercise, and we need to go through painstaking. I think we need to put out more tailor-made messages which would let people appreciate what they are. Look at the personalities who are getting affected. A lot of people think that COVID is nowhere close to them. I believe that the risk perception is truly low, and one of the things we need to do is to put out programs and messages which would, in a way, increase the risk perception. If you know that you can get it, I think you take precautions. If you let people know that they should take themselves as the only people who do not have it, and that every other person has, I believe that people will be more careful when they are stepping out of their homes. Because whether like or not, COVID is with us, COVID is real, and we take steps to ensure that we protect ourselves from COVID.
Look, as we talk about the population dynamics, it's, I'm told, intrinsically linked to public health. How do we link that?
You see, once we interact, an infected case will not live in isolation. You interact. As you move from your house to the workplace, as you move from the hospital to the electoral area, you never know who is going to meet and where the person has gone to. And when it comes to these health-related issues, responsibility is one of the key things that we need to do. Accepting the fact that you are at risk is one of the ways by which you can avoid getting the risk. Until we get to a point where all of us would appreciate the fact that we are all at risk, I believe that we're not going to make any headway. But once we accept that we are at risk, then we take a right measure. And I think that sometimes the case count is up. Is it close to 20,000? But I think the focus for me should be on the active cases. We should also look at the number of people who have recovered from the infection. I don't think we are doing badly as a country. And what we need to do is to sustain the positives. And once we do that, we use these recoveries as a way to let people know that there's a way. Also, we need to let people who have recovered probably step out there and help with education. Can these people come out to share their experiences with people? For me, I think that once we know people, we can see faces and identify the faces with real people. I believe that people will change their way. A lot of people think that it's so far from them. But if you know somebody who's had it and the person comes to tell you his or her experience, I believe that we can work around it and try to change those attitudes and behaviors to work. Yeah.
We also do have on the line, alongside Dr. Eugene Datte, somebody who is a regular contributor to the show, Professor Kwame Nasego, a virologist with the University of Ghana Medical School as well. He's also a Reverend Minister, so it helps for us to mix the medical practice or the clinical aspect with the godly aspect. But Professor Sego, from where Dr. Datte left off, he seems to say that we seem to be doing well comparatively with other countries. So that means that we shouldn't be creating some level of fear and panic. Should that still be the refrain? Professor Sego?
Can you hear me?
Professor Sego, can you hear me?
Yes, I can.
Okay, did you hear my question?
Can you hear me?
Yes, I can. Can you hear me?
Okay. Yes, I can hear you now.
Great. So I'm speaking to Dr. Eugene Datte. So all of us are going to have this conversation. From where he left off, his last submission, he seemed to ultimately suggest that we are doing better than other countries. Is it that then we shouldn't be spreading fear and calm? We shouldn't be alarmed from your point of view as a clinician?
Well, I'm not a clinician, actually. I'm a virologist, basically. But I heard the last part of his contribution. I wasn't in through the beginning. Can you hear me?
Yes, I can. Please go ahead, sir.
So I heard his point that we may not be doing badly. I admit, I'll be the first to admit that there are challenges. And it's a global thing. Even the advanced economies are having challenges. But we should do the best we can within the means that we have. Okay, so I heard him also significantly talk about the fact that when we are thinking of the number of cases, we should also think of the number of recovered cases. Of course, there are new guidelines for recovery that I'm not too clear about. I'm not in the terms of the testing and whether there will be a residual spread, even with releasing people that way. But that said, I think that the emphasis should be on us ensuring that the preventive measures that we have put in place are really working. I just, you mentioned that I was a Reverend Minister. I was from church yesterday, and I passed through a particular place. I wouldn't mention names. There was a gathering going on, and I can put my head on the line that I didn't see a single person in mask. There was no social distancing. This was a community of people who were sitting inside a compound and on the roadside, having, I don't know whether it was a funeral, whatever it was, but not a single person was in mask. So that really is a problem, that now the scientists are saying that this thing could be airborne. I know that in Ghana, I don't have all the data, but I know that in Ghana, they seem to be having a lot of indoor transmission, really strongly suggesting probably an airborne. We need to use the mask, and we need to watch the way we aggregate for meetings. I think it is critical. I think that is the critical, most important thing that we need to do now, and we need to encourage people to do.
Okay, so you, the virologists, and those at the medical field, you are saying that the fault is ours, the population.
We're not saying the fault is ours. I said that I'll be the first to admit that there are challenges. For example, hospitals are complaining about PPEs, frontline workers. I consider frontline workers as anybody who comes into contact with any patient, not the person who deals with COVID-19 patients, because you may be dealing with asymptomatic patients, people who are coming to the hospital, who are coming not because of COVID, but for other reasons. So, yes, there are challenges. I'm not saying that there are no challenges. There are challenges. I'm just trying to say that if you look at the big picture, and we should look at the big picture, big global picture, it is not only Ghana which has challenges. Most countries have real big challenges. If you look at the testing, even the complaints we are making about testing, I can send you a summary of testing algorithms for countries even within the West African region. You realize that Ghana is doing fairly well in terms of testing per million of population, even though we say we are scaling down testing. So my point is that we are not doing bad. I'm not saying that there are no problems. There are problems, and there may be major problems. But let's build up on where it is, and let's make sure that the population also adheres to. I'm becoming very pessimistic about population adhering to. I'm sorry for saying this, but because people argue. I've had an opportunity, situation where somebody actually argued with somebody just by me in a shop. We were using an elevator, and he wasn't wearing a mask. So I asked him, why aren't you in a mask? And started giving excuses. And an attendant called him, and the attendant from the shop told him that people are dying. He actually burst out, was angry that the man should show him the number of people who are dead. He hasn't seen a dead person. This is in Africa. I'm not saying and telling you a story. I'm telling you something that happened in my presence. So people don't believe, and that's a fact. People think that they are excluded because they haven't seen any dead person. So unless, if we really want to curb the spread, we cannot rely on only government to curb the spread. We all have to make sure we play our part. And I'm not sure how this will work within certain communities, actually. Unfortunately, I have to say this.
Okay. Dr. Date, do I get the sense that the experts like you, Professor Sego, you have the solutions, but it is us who just don't get the message? Dr. Date. Dr. Date.
Yes, hello.
Yeah, okay. Do I get this? Yeah, can you also hear me?
Yeah, I can hear you.
Do I get the sense that it is you the experts, you those who have the know-how, who get the message, who seem to have the right solutions, but us in the population, it is us who just don't get it, don't know what to do?
I think that I wouldn't want to shift the blame. What I think we need to do is to have a communication plan to deal with COVID-19. I want to see the communication plan. But I don't think that we're really doing we're targeting properly. There are different target groups, different segments in our country. That's why for me I asked if we could get some data to know who and who is getting infected and who is observing the protocol and who is not. Because we need to understand why somebody doesn't want to observe the protocol. So let us also appreciate the fact that when these protocols are new to us, they are like innovation. And with every innovation, We expect only a few people, just less than 12%, to begin the process. But as the process goes on, as the campaign gets intensive, and as the campaign gets more targeted at specific populations, you will get there. Unfortunately, behavior change is a slow process. Behavior change is not a linear process. There are people who decide to wear the mask today, people who decide to wash their hands, and they will go back to a situation where they will not wash their hands because as they go to a place and they didn't get the rental bucket or whatever. You need to enforce. To get the process started, you need to enforce the rules. If somebody who is wearing a mask, that person should not go everywhere close to, say, the registration center. If you are in an office and somebody comes in without a mask, send the person away. If you are a taxi driver and somebody is going to blow the taxi without a mask, send the person away. We need to have with the process. We cannot leave all this to only government and to the people in the health ministry. All of us as a people must have this responsibility. Let us all be change agents. Let us all insist on the right thing being done. And with that, I believe we can make progress. Let us also appreciate that population change or behavior change is not an event. It is a process. It is a very, very difficult process to go through. And we must put our shoulders to the wheel and ensure that we all achieve it. So it's communication, proper segmentation, and also enforcement of the procedures that have been put out there by government and by the health officials.
Professor Sego, it looks like we've not been leading by example then, have we? Because if you look at the pictures and what the stories have been, even the so-called big men have been flouting what you think should be the order of the day by the population.
Yes. So that's why I said that I'm not absolving anyone. There are problems, but we shouldn't rely on only government to solve the problem. Yes, leadership by example is important, and I was going to bring up this issue. I thought that Dr. Date approached on it a little. Where are our community leaders at this time? Do our community leaders believe that this is real? I see myself as a community leader, and at church yesterday on Sunday, after every service, I spend a minute or two telling them something. So yesterday, for example, I tell them, don't hold the face of the mask, because it may be contaminated. But if in case you do handle it, use the sanitizer immediately. That is my responsibility as a leader, as a community leader in the church. So I'm ensuring that we are following rigidly the rules and regulations that we have, social distancing, washing of hands, and we've done that successfully, by God's grace, for about 3 Sundays. My point is, this is a time when we should use the various communities to, the first and foremost, we should make the community leaders believe that this is true and that this exists. Let me give an example. Why can't we, for example, and I don't know if this is done, I don't know if this has been done, so I'm speaking as somebody who doesn't know exactly what has been done on the ground. These are just suggestions that are coming. So just please let me make this disclaimer so that it's not said that I said it is not being done. I'm not sure. So what about if having even a video conferencing or a Zoom conferencing with all chiefs, the National House of Chiefs, and with the number of chiefs, them being held so that there could be some communication with them, because when they speak, people listen. Where I passed yesterday, I am sure they are community leaders. If we make the community leaders believe, when they go to these meetings, they will insist that people should put it on. And when they speak, people will listen. So this is the time, I know this has come up months ago, this is the time for us to focus on the community leaders. Just like when politicians went on vote, they go to the community leaders. I mean, they go and talk to them before they enter the community as a way of showing respect. Why? We should get back to the community leaders and make them aware. I don't know if all of them believe, but if they do, to try to give them enough proof that this is real. So in your own small way, how can you help the community to be able to do this? So my point I'm just trying to make is that I'm not shifting blame. It is a general problem. I see myself as part of the solution. And the little way that I can, I will do the best I can. But if everybody tries to do the little they can, we will reach somewhere. I mean, if you see some people speaking and friends on the road, you see friends speaking, and then they don't drop their mask. When they've met friends, that is when they've actually dropped their mask. And they're chatting, happily chatting with each other. And we've left the crowd with the mask is down. Do you know where your friend has been to? Do you know where your relative has gone to? They are real issues. And I think that we should look at the big picture. And the point I'm trying to make is that, of course, as much as I am having challenges with even the I'm not sure. Maybe that's how we have to go. Let's identify community leaders, people who speak, and people listen. Let them lead by example and try to get to the community through various means, safe means, to make sure that the lesson is sent out.
Well, very well. Well, thank you very much. Dr. Eugene Datte is a population and health expert with the University of Cape Coast. Dr. Datte, good morning to you, and thank you for this great contribution. And we're hoping that all of you also can send a message out there that those around you in the communities that you serve, your students, could also get all these updates on JoyNews TV, which is our live YouTube channel, and also for Facebook, going with the same name and get all these updates.